As of 2023, there are approximately 39.9 million people living with HIV worldwide, including 38.6 million adults and 1.4 million children. In St. Lucia, the HIV incidence rates are 0.23 per 1,000 people for those aged 15 to 49 and 0.14 for all ages. The number of deaths due to AIDS is less than 100, with similar figures for adults aged 15 and over. Population Communications International (PCI) Media Social Behavioural and Intervention Specialist Bennett Charles emphasized the need to address misconceptions and stigma surrounding HIV or AIDS. Charles works with an international organization focused on health, environmental issues, and social justice. The organization collaborates with various countries to design programs aimed at encouraging behavioral change related to HIV/AIDS. He noted that the difficulty in discussing sexual health contributes to the stigma associated with HIV and AIDS, leading individuals to believe that contracting the illness is a result of moral failing.
One of the critical things I think we need to deal with we come to talk about the HIV and AIDS and the stigma associated with it, I think is one of the first things is that because predominantly most persons who contract HIV is through sexual intercourse. And we sort of have our hiccups about sex, whether because we are a very quote-unquote Christian society or a very religious society. Anything that has to do with sex, there's a hiccup about it.
He stated that advancements in medicine have transformed the management of HIV infections, making them far less daunting than they were 40 to 50 years ago. He highlighted the importance of not only informing the public about the stigma, but also providing support for individuals living with HIV, emphasizing that they can lead normal lives. Charles acknowledged that awareness programs have been impacted by the COVID-19 pandemic.
We had, I think, generally, we're on the heels of World AIDS Day, and it's been very quiet. However, we know that the theme this year is take the rights path in terms of people understanding the right to your health and the right to be able to access health services. I think one of the critical things is the fact that in the past, we had a lot of sensitization programs happening. I think they were very effective. But I think because COVID took over, we sort of lapsed. And we need to get back to that. Because people actually believe that when you say HIV, like, that's still around. You know, there's that sort of sentiment. So I think we need to get back on that campaign.
Despite this setback, he mentioned that the Ministry of Health and the Infectious Disease Unit have launched effective initiatives, including awareness campaigns and recent training programs for rapid testers. However, Charles pointed out that services for people living with HIV/AIDS are still insufficient. He explained that much of the programming in the Caribbean is donor-driven, meaning that countries often rely on international donors for funding.
When the money dries up, really and truly, the government and NGOs like ECAID, like St. Lucia Planned Parenthood, really and truly, they're the ones who have to find sources of fund to get these sort of services going, especially when it comes to the counseling. Testing is free in St. Lucia. Testing is available. The ministry just launched a new set of testers, but the resources are limited because at the end of the day, sometimes the world, like I said, is donor-driven. Whatever is the new sexy topic, the world will shift to it.
He stressed the need for national health systems to secure funding from national budgets to support health programs and empower local organizations like St. Lucia Planned Parenthood to develop innovative solutions for resource allocation. He emphasized the importance of helping individuals understand their health rights and taking personal responsibility for their well-being. Kayla Edwin, MBC Prime.